Neck pain occurs when the neck starts to straighten out just like this spine here. It's called hypolordosis, and this happens when there's upper cervical misalignment, changing the muscle tone of the neck. These top two bones in your neck hold up the weight of the skull, and when misaligned, they shift out of place, they irritate nerves, and they change the way that the muscle tone is in the neck. There's something called the traps, the scalenes, and the SCM muscles. And when these nerves up top are irritated, it sends improper tone to the SCM, the traps, and the scalenes. And now it starts to pull your neck straight, and it leads to changes in the biomechanical and the structure of your spine, leading to compression on discs and irritation of very important nerves. This neck pain starts as acute, and many times it doesn't go away. It turns into being chronic, and now you start to get arthritis in your spine and degeneration because of the instability in your upper neck. This female came to us with chronic neck pain she'd been dealing with for quite a while. And she came into our office to get these 3D scans to see exactly what was going on in her upper cervical spine. We found that her upper neck was misaligned. It was tilted up, shifted over to the left, and rotated. We had been correcting it for 2 to 3 weeks, and her neck pain was almost completely resolved. So if you're dealing with chronic neck pain and you're looking for a natural solution and you want to get to the root cause, you need to find an upper cervical chiropractor. We offer free consultations, or go to www.uccnearme.com to find an upper cervical chiropractor in your area.